Okay, guys, we're moving on to one of our final chapters in the book, Gynecological Emergencies. And this will actually lead into the next few chapters, which are going to be about the birth process, neonates, pediatrics, that whole thing. So we can start here, though. So just for this chapter, just know the general anatomy and physiology of the female reproductive system. And just know the parts. Know what an ovary is, know what the fallopian tube is, know what the uterus is, stuff like that. Nothing too complicated. We're not going to, speaking of complicated, we're not going to go into the menstruation process a whole lot, but if you guys are wondering, it is pretty complicated. So at higher levels of EMT, you will be expected to know some of this stuff, but at the EMT level, you don't have to, but it is good to know that there's a lot that goes into the menstruation process. Okay, this is the point of the chapter basically, is PID, pelvic inflammatory disease. So it's an infection of the upper organs of reproduction. So uterus, ovaries, fallopian tube, stuff like that. Pretty much only happens with sexually active women. It can result in an ectopic pregnancy or sterility. So we definitely this is a serious thing though, because it can have long-term effects if we don't manage it correctly. One of the leading causes of PID are STDs. So chlamydia. The dangerous thing about chlamydia is some people don't have any symptoms, so they can be spreading it and they won't even know. Gonorrhea. So gonorrhea and chlamydia are the two most common STDs, and they can lead to PID. So it's not necessarily like, oh, harmless thing, I'll take some pills, I'll be fine. It actually can do a lot of damage. Now for bleeding, it could just be menstruation, or it could be some sort of vaginal trauma or an pregnancy, or spontaneous abortion, cervical polyps, cancer. Vaginal bleeding is always something that you have to take seriously because you just don't know. You can't have X-ray vision. I'm not sure what's going on inside there, right? So especially if it's someone outside of menstrual age, or if they just had their menstrual cycle bleeding. So we're not going to be able to make a diagnosis in the field, but we got to ask a lot of questions, check vitals, those kind of things, and do our best guesswork. So when the hospital takes over, they can start where we left off. It can involve a large amount of blood, and if there's any sort of assault suspected, definitely get law enforcement there and kind of have them start their own investigation. And this is a big deal. If you can get a female EMT, you know, even if they're on a different run, a different ambulance somewhere else, if they're not busy, try to call them over. We want to have same gender if possible. So try to figure out some of these things from like dispatch information if you can, but a lot of it's not going to show up until we get there. Most cases are not life-threatening, but like I said, it could be some sort of PID thing that results in sterility or something, and so we want to be careful with these. So unfortunately, yeah, they're going to be personal questions. We're going to have to do that. Like if you can, here's just a little tip: if you can, and you're questioning a younger person, like in their teens or something, try not to have the parents in the room, only because you will most likely not get an accurate answers to your questions. I've seen it where a patient says this and that and the other, and then the parent leaves, or they go to the hospital and now they're alone, and now they have an entirely different story. So if you can, I mean, it might rub the parents the wrong way and you can kind of feel it out, but sometimes you want to get that most honest answer, and you may not get that with the parents. So we basically want to limit the number of people involved and try to have a female EMT if we can, and just use those external pads. And it's cool to count the number of the pads because that'll give us a rough idea of how much blood loss has occurred. So because we don't know exactly what's going on with these gynecological emergencies, we have to take a full set of vitals and try and steer our treatment and figure out what's going on. So full set of vitals. Okay. It says very few interventions. That's true. There's just not a ton we can do. We can treat for shock if that has developed over the course of a few hours or something. But in and of itself, there's just not a lot we can do in the hospital for these. So communicate and document everything as much as you can, especially sexual assault cases. That your documentation may end up in court at some point. So very important that you do a good job documentation. Once again, maintain privacy as much as possible. Consider moving the ambulance, turning it around if the windows are open or something. Try to cover them up with a blanket if you can. That person's probably, feeling pretty bad in that they had to call 911. And the last thing they need is to be naked in front of a bunch of strangers. So do what you can to protect their privacy. So these will be very painful. And like I said before, just try to get a count of how many sanitary pads were used because the hospital will want to know. Okay, so treat external lacerations, just direct pressure. They kind of like diaper type bandage, so really just wrap it around the legs, around the waist, through the belt if they're wearing one, stuff like that. We don't want to pack anything inside because it can lead to infection, all sorts of other things. So we just want to hold some direct pressure, take to the hospital. Okay, so these pelvic inflammatory disease, right? Most likely caused by STDs, but it can be caused by other things as well. Usually starts during or after menstruation, and they say may be made worse by walking. There's something called a PID shuffle, which is just a certain way they walk, because walking normally is very painful. So I've seen ER docs see a patient like walk in and be like, "Yep, PID," and they don't know anything. They just see the kind of unique way they're walking, and most, at least in my experience, the doctors I've seen do that have been correct. All right, so just last little thing on sexual assault. It's a problem. I mean, it's a problem in America, but it's even worse the rest of the world. So it's a very complicated issue. There's a little bit of a scene safety thing if the perpetrator is still in the area, but it is relatively common. And if we want to, solve this and give the best possible treatment for that patient, that victim, it's up to us to document and communicate correctly. So, and they say right here, how you manage a situation may have lasting effects. That is very true. They have just experienced a terrible situation, and you are going to be the first person there to kind of help them through it. So the things you say, how you act, the choices you make can have, honestly, a lifelong impression on that patient. So be careful and be professional. And you can generally expect police involvement because we need to figure out what's going on, and we need to try and we can treat the medicine, but we also got to work with the police and try and have them start their investigation. And once again, just have that female EMT treat if possible. So especially in sexual assault cases, there may not be a lot of trauma or anything as far as physical trauma. So the most important thing we can do in that environment is provide the best medical treatment we can, if there is some. Provide that psychological care. That goes back to the whole professionalism thing. Preserve evidence as much as possible. Ask patient not to clean herself. That's very important key. So police are looking at a crime scene, right? They want to look at the crime scene and figure it out. Well, unfortunately, that patient's body is the crime scene. So can't go to the bathroom, can't shower, can't do any of that stuff because there may be some evidence that's on the body. Okay, so of course, this might be difficult because that woman might really want to shower like immediately, but we have to prevent her from doing that until the cops can do their stuff and we can try and figure this out. So there's phone numbers they can call. There's crisis centers, like, and some of the hospitals have like counselors and stuff like that, so definitely set them up with it. Take a good patient history and then produce a patient care report. Make sure it's accurate and well done and professional, because remember, if it comes to court, they may end up pulling your patient care report in front of the whole courtroom, and they may evaluate your patient care report in the court. So just be very careful and professional when you're writing those patient care reports. So, all right, speaking of that, don't lie on your patient care report. So that was a real quick lecture. Basically, it's PID. Just know what PID is and know some of the causes. And all the rest of the gynecological stuff we are going to hit when we get to birth and that whole stuff.